everyone, this is Desi Villaruz and welcome to my channel. I'm here today to discuss with you what is urinary tract infections. Again, my name is Desi Villaruz. I'm a health provider here in Orlando, Florida. And many of my patients come to my clinic and they wanted to get consultations or treatments for what they are explaining to be a urinary tract infection. So what is UTI? Urinary tract infection or UTI can happen anywhere in your urinary system, which includes the kidneys, ureters, bladder, and urethra. But they are most often caused by a certain bacteria or germs that can get into your bladder. Some of these microorganisms or bacteria are the Staph aureus, Strep, E. coli, and these are some of it are just normal flora inside our system, but when our immune system go down, they can replicate and create bacterial infection inside our bladder. So UTIs are also called bladder infection, which are common especially in women. More than half of women will have at least one UTI at some point in their life. UTIs are serious and often painful, but most UTIs are easy to treat with simple antibiotics. The slide can get very slow or fast for us, so I will try to cope up with the screen or the slides. So let me tell you more about who among women gets UTI. So women get UTIs up to 30 times more often than men do. It doesn't mean that men will not get it, but 30 times more often it's women. And you may be at greater risk for UTI if you are sexually active, if you use a diaphragm for birth control, or you may use a spermicide. These are creams that kill sperm with a diaphragm or with the condoms. If you are pregnant, you are also high risk. If you have gone through menopause, if you have diabetes, and if you have or had inserted any catheter, you may be at risk. So what are the symptoms of UTI? If you have a UTI, you may have some or all of these symptoms: pain or burning when urinating. You may have frequency, an urge to urinate often, but not much comes out when you go. There will be pressure in your lower abdomen, and urine that smells bad or looks milky or cloudy. Blood in the urine. This is more common in younger women. If you see blood in your urine, tell a doctor or nurse right away so that you can be treated as soon as possible. You don't want this to go on and suffer before getting any intervention or any kind of help. So as you can see in the slide, there is a bladder infection that states that the anatomy of the ureter, where the ureter is, the bladder, that has harmful pathogens enter the bladder, causing inflammation or cystitis. If you are sexually active and you go into certain activity, you may have what they call honeymooners cystitis. That's actually a bladder infection. Some women will be complaining of feeling tired, shaky, confused, weak. These are more common in older women. Having fever, it may state that it may be going up to your kidneys. So be very careful with that. So how is a UTI treated? So there are many antibiotics that can be given to a simple UTI. Your doctor will prescribe you antibiotics to treat a UTI. You may feel better in 1 or 2 days, but please make sure to finish taking your antibiotics as prescribed, even if you're feeling better after a day or two. If treated right away, a UTI is not likely to damage your urinary tract. But if your UTI is not treated, the infection can spread to your kidneys and other parts of your body. The most common symptoms of kidney infection are fever and pain in the back where the kidneys are located. The antibiotics can also treat kidney infections. So what I do is I will turn them sideways and tap into the lower back, and that's what we call the gastrovertebral pain. And if they feel pain in their lower back, that is infection going up to the kidneys. So how do UTIs affect pregnancy? One of the example is that pregnant women are high risk. So why? Changes in the hormone levels during pregnancy raise your risk for UTI. UTIs during pregnancy are more likely to spread into the kidneys. If you're pregnant and have UTI, symptoms of UTI, tell your doctor right away or your nurse. Your doctor will give you an antibiotic that is safe to take during pregnancy. If it's left untreated, it could lead to kidney infections and problems during pregnancy, including premature birth, which is the birth of a baby before 39 to 40 weeks, and low birth weight of smaller than 5.5 pounds at birth. You may get high blood pressure, which can lead to a more serious condition called preeclampsia. How can I prevent UTIs? So there are myths, misinformations, what you can do, and wait until you go and get tested. So what we can do to prevent it, you can take steps to help prevent UTI, but you may follow these steps and still get UTI. So please, women, please very careful. Urinate when you need to. Don't go without urinating for longer than 3 to 4 hours. The longer urine stays in your bladder, the more time the bacteria have to grow. Try to urinate before and after sex. Don't forget. Always wipe from front to back. Try to drink 6 to 8 glasses of water every day. Clean your anus and outer lips of genitalia each day. So women that are in the other parts of the country, we normally use our water and gentle soap after each use of the toilet. Do not douche or use feminine hygiene sprays. And if you get lots of UTIs, tell your doctor if you're using spermicides. What should I do if I keep getting UTIs? Women who get 2 UTIs in 6 months or 3 in a year have recurrent UTIs. Your doctor or your nurse might do tests to find out why. If the test results are normal, you may need to take small dose of antibiotics every day to prevent infection. Your doctor may also give you a supply of antibiotics to take after sex or the first sign of infection. So if a patient comes to me, I may say Bactrim or trimethoprim, or I can give them Cipro. So it's just depending on the patient coming in with their labs and with their situation and their age. So depending on those, what prescription I may give them and how many days it will last. So to prevent recurrent UTIs, I would tell my patient to take probiotics, and these probiotics will keep the body's normal flora population balance. This will help the body defend itself against internal infections caused by bacteria. Cranberry juice or cranberry supplements are handy to have on hand for relief of bladder and urinary tract and discomfort and pain. Drinking coconut water on a regular basis can help to cleanse the bladder, helping to prevent urinary tract infection, and also it will dissolve kidney stones. Don't drink a lot of sodas that will give you more kidney stones. Sodas, caffeine, those are tea. If you're prone to getting kidney stones, stop doing those and just drink water. One of the things I would recommend my patient is to take AZO or pyridium. It's actually pyridium. It will relieve your urinary pain, your burning, your urgency, and frequency associated with urinary tract infections. If they cannot come to my clinic, if there's something, you can go and get this over the counter at the first sign of discomfort. Take it right away. So I will tell my patient to take 2 tablets 3 times daily with or after meals as needed for up to 2 days, and take it with a full glass of water. Do not use for more than 2 days, and make sure you consult your doctor. I would just want to warn you that if you urinate after taking the AZO, your urine may be orange, and that is normal. D-mannose supports overall urinary tract health. You can take this every day regularly. It reduces binding of unwanted bacteria to the lining of the urinary tract. It balances your urinary tract flora. It decreases significantly the risk of recurrent UTI. And for preventions, I tell them take 2 grams once a day or 1 gram twice a day. For treating an active UTI, take 1.5 grams twice daily for 3 days, and then once daily for 10 days, or 1 gram 2 times a day for 14 days. So this is just a usual recommendation. If they keep coming back for more antibiotics, I tell them, hey, take D-mannose, and make sure you always refill this. And this is over the counter. You can get it from any of your local pharmacy. So that's it for me for today. I hope you enjoyed, and I hope I have enlightened you with questions regarding urinary tract infection. And there will be more simple presentations in the future from this channel. So please come back. And if you have any question, I am open for live streaming and free consultations online.